make us the halfway point for CNA lecture. Chapter 28, 29, and 30. The first chapter, chapter 28, is all about indwelling or urinary catheters. So urinary catheters, I have a couple examples up here. I'm going to pull this one out several times. But a urinary catheter, one example of it is going to be right up here with this bag and the tube inserted up here in the patient that we're going to get some practice with today. So it is inserted in through the urethra, no matter what type it is, and into the bladder. So through the opening going into the urinary system, a urinary catheter itself drains urine into a drainage bag. There are a couple different types of drainage bags. There's the drainage bag that I have right there. There's also what's called a leg bag, and this attaches either to the thigh or the calf, and these are for patients that mainly have to go home on a catheter or so forth, that they can somewhat keep it concealed as well. So there is one more example. Those two examples right there, those bags, those are going to be what's called indwelling catheters, meaning it stays there for as long as it needs to, stays inside. But there's also another option that's called a straight catheter, or it's also known as an in and out catheter, because you put it in, the urine drains out from the bladder, and then you pull it right back out immediately. So that is called a straight catheter. It drains the bladder and then it's simply removed. The indwelling catheter, these are going to stay in there for whatever amount of time that is needed, and they are left in the bladder. The catheterization is defined as the process of inserting the catheter. An indwelling catheter there's going to be a balloon tip that is inflated. And if you look up here at the picture, so if you're seeing kind of this pumpkin-like thing on the picture, that's where the balloon is inflated to hold the catheter in place. Okay? Yeah?
We don't have AP, right?
We don't have AP.
Okay.
Nope. So this helps keep that balloon in place. So when we take out a catheter, though, we have to make sure and to deflate that balloon before we would pull out. Otherwise, it causes a lot of damage, and you're going to see patients that accidentally pull theirs out or pull theirs out on purpose because they're having some confusion, and they are going to really be in a lot of pain. There's possibly going to be blood because they have pulled that balloon and everything through those organs that is not meant to be. Okay? So that is always a possibility and happening and so forth, but the balloon really has to be deflated before removing the Foley catheter. Okay? Catheterization is done by either a doctor or nurse. With proper education and supervision, though, some states and agencies let CNAs pull out Foley catheters, but most do not. There is a chance, if we're at a facility and I'm with you, that I could help you in that I could do it and have you assist with me. That's okay since you're with me, kind of thing. Does that make sense? But otherwise, you can do catheter care, and that's what you're going to do, and you even have a CNA test still for that. Catheters are used before, during, and after surgery. Many people have had a catheter inserted and removed before they wake up, and they don't even realize that they've had a catheter in while they were in surgery. Okay? They're also for people that are too weak or disabled to use the bedpan, the urinal, the commode, or the toilet. They're used for patients that have pressure wounds or injuries from contact with urine. They don't need that on their skin anymore. And also, on a very, very sick patient, would allow for hourly urine output and a very exact measurement of that. It's a last resort for incontinence. To collect sterile urine specimen, you have to put in a catheter, whether it's a straight in and out or whether it is an indwelling catheter. You can measure residual urine as well, but for when caring for these patients, the risk of infection is very, very high for them. These patients may start off with some confusion and so forth, but if you have a catheter in place, they are at very, very high risk for infection. So now we no longer just keep catheters in just because. We also just don't insert them just because it puts them at such a high risk for an infection. So the urine drainage system, the bag that is attached to them and so forth is going to be pictured here. This is a closed drainage system. It's used for the indwelling catheters, and that means that nothing can enter the system from the catheter to the drainage bag. Some people wear those leg bags like I showed you up here and attached to the thigh or calf when standing up. But one big rule, whether you have to move the patient over to the chair or over to the wheelchair, or you have to go move them for a procedure, is that you have to keep this bag, no matter what type it is, leg bag or a dwelling catheter bag, you have to keep it lower than the bladder, okay? Because if you put it at level or above the bladder, the urine actually, because of gravity, goes back into the bladder, okay? And if old urine goes back into the bladder, then that's going to cause a urinary tract infection again, and cause more issues. So most bed frames and places have a hook or an area where the bed's not moving. So don't put it on a piece where the bed does move up here. This is the part of the bed that moves. But the immovable part of the bed you can attach the catheter bag to. And coming up is going to be a picture of a wheelchair. Oh, let me see here. Oh, it's a ways off. Oh, there it is. A wheelchair drainage bag holder. Not all places have this. A lot of times you just got to hook it on the side and go. But some facilities, especially patients that are using the catheters a lot and so forth, are going to have this kind of self-esteem holder that kind of hides that catheter bag. Okay? So make sure that you keep that catheter bag lower than the bladder at all times. Another option or type of catheter is called a suprapubic catheter. And so this is more of a permanent catheter that stays in place that you can hook to on the outside of the body, the tube to. So a lot of patients with cystic fibrosis and so forth, they end up having to have a suprapubic catheter placed, and they just go in and hook into it from the bathroom, drain their bladder, and they're done. Okay, but it's going to be not through the genitalia area, but on the outer abdomen and the pubic bone area is where it's going to be located. This again, picture B, is an example of a patient setting down, but the catheter bag or drainage bag being lower than the bladder. If the drainage system becomes disconnected, then you should tell the nurse immediately. Do not touch the ends of the catheter or tubing. Practice hand hygiene and put on gloves. Wipe the end of the tube with an antiseptic wipe. Alcohol wipes are antiseptic wipes, okay? Not Lysol wipes, but alcohol wipes. Ooh, alcohol wipes. Those are considered antiseptic wipes. Wipe the end of the catheter with another antiseptic wipe. Do not put the ends down at all. And do not touch the ends after you've cleaned up with those wipes. Connect the tubing to the catheter. Discard the wipes into a biohazard bag or the trash bag is okay. And remove the gloves and practice hand hygiene as you normally would when you remove gloves. Leg bags have to be changed pretty frequently or when the patient is in bed. You're going to open the closed drainage the drainage system here, and when you're doing that, you're preventing microbes from entering into the system. Drainage bags are going to be emptied and urine is measured at the end of every shift. So there's at least 3 shifts in a 24-hour period, so 3 8-hour shifts. Also, they need to be changed whenever you're changing from a leg bag to a drainage bag, or you're changing from a drainage bag to a leg bag, or if the bag is becoming full. Honestly, when you're at clinical, if you're seeing more than a small amount of urine, you can go ahead and record that down, empty the Foley bag, especially if you have to move the patient. Record that amount down and then take it to the nurse to chart because we actually do not document much at our clinical sites ourselves. One thing that's important to note here is that picture B here has this band to help hold the catheter in place so where it doesn't tug on the bladder, which is very, very nice, but not a lot of places come with that. Another option that's more frequent here is going to be a piece of adhesive that's attached to the catheter. And that's going to be this device right here too. So you put this adhesive down to their skin and it kind of holds it in place and puts a little slack up here on the patient. Okay, so the adhesive is going to be picture A there. So this is going to be how you're going to attach that adhesive or that tape to the patient, and then how you're going to, there's a female patient A and B is a male patient, depending on where the drainage bag is. And then also on picture C is going to be an example of that leg holder. And so you have to face the penis down in that circumstance. Otherwise, if you're taping it, we're going to prefer that you tape it up. Okay? So this is going to be examples of scenarios that you should see with catheter bags, and you are going to see this as well. So this is that picture I showed you before, the drainage bag holder. These are just some different parts of the catheter themselves. And one of the things that we talked about last week was bladder training. Okay, bladder training was when we go ahead and clamp the catheter off for an hour or two. That gives them the sense of urge, oh, my bladder's getting full. It gives us, just like you and I have to do, because we're not incontinent, right? that we need to feel that sense of urge to retrain our bladder. Otherwise, when you have a Foley for a while or a catheter, those two words mean the same thing for a while, your bladder gets lazy. The muscle's not working. Okay, so then when you get it pulled out, if you don't do any bladder training with it or clamp it off for a few hours and let them go, clamp it off for a few hours and let them go, if you don't do that, then it's like, oh, I don't know what to do. And you do have to go to the bathroom, but then you can't go. Does that make sense? So that's why bladder training and clamping it off for every couple of hours is going to be important when you get close to needing to remove the Foley. You do have to have a physician's order for that bladder training though, and so forth. We will be doing peri-care with the catheter. It is a skill checkoff that we have to do for state checkoff. It will of course be on a mannequin. And so we will be doing this as a state checkoff. So this is peri-care with a catheter. It is showing you, when it's talking in the video coming up, about starting at the meatus or the opening, and then you always go in a downward fashion. Okay, then you use a new portion of the washcloth and do the other side and go in the downward portion. Removing a catheter. A catheter itself has two different lumens or passageways, tubes within one tube. Okay, sterile water is going to be injected through one lumen to inflate that balloon once it's in, and then urine drains from the bladder from the other lumen. A physician's order is needed to remove the catheter and to put one in. Most people need bladder training first, and dysuria, which is difficulty urinating, and urinary frequency are very common after removing catheters. People are like, I feel like I gotta go, and then I can't go. So that's difficulty urinating, okay? So until they kind of get used to it and so forth, they do kind of have trouble at first after having a catheter going to the bathroom. So this is showing you how to empty a drainage bag, and that's a skill that we're going to do practice today. So they have the drainage bag hooked, of course, to the bed there on a non-movable part. They are unclamping this tube down here at the bottom. That's the only one you ever do. So you're pulling it out of the plastic piece here. Then once you're over a graduated cylinder, then you're going to unclamp and drain the drainage bag, clamp back up, and put the tube in place. Then you are going to measure the urine in the graduated cylinder, pour it in the bedside commode or the toilet, preferably the toilet if there's one in the patient's room. So you measured it, write that down, get rid of it, then you're going to rinse this after you do the urine and put everything away. Okay, and I have a video for that that's going to be showing you guys that. So testing the balloon before we even do the catheter placement, because if you put it in there, then you think you're inflating the balloon, but it really didn't inflate. That doesn't do any good. So a properly inflated balloon, you check before you even place the catheter at all, and it should look like this versus this wouldn't quite keep it in there all the way. Okay. So this balloon gets checked, withdrawn, and then re-put in once it's in place. Another example of catheters is going to be a condom catheter. So these are external catheters, great for short-term use or incontinent patients. They go on just like a condom. The tube, though, is at the end. They're not internal, so there's not quite as high a risk for infection and so forth. They need to be changed out daily after peri-care. But one thing is that you don't put the adhesive tape actually on the skin anywhere of the penis, but you can put it on the outer covering of that condom catheter. So here's going to be an example here of a condom catheter. It goes on, rolls on just like a condom. And then the tube here at the end, okay, and then going down to the drainage bag. Alright, so I have two videos here I need you to pay very close attention to. It's very important that you know these skills.
For resident,
this is the longest one right now.
Catheters, daily care of the genital area is important. Because the catheter goes all the way into the bladder, bacteria can enter the bladder more easily. The genital area must be kept clean to prevent infection. The catheter drainage bag must always be lower than the hips or bladder. Urine must never flow from the bag or tubing back into the bladder as it can cause infection. When cleaning and rinsing the catheter tubing, hold the catheter at the meatus without tugging it. Clean at least 4 inches of the catheter nearest the meatus and move in only one direction away from the meatus. Use a clean area of the cloth for each stroke. In this video, we are using a mannequin to demonstrate the cleaning of the genital area and the tubing for a female resident. your beginning steps. Identify yourself and state your title. Identify the resident. Wash your hands. Explain the procedure to the resident. Speak clearly, slowly, and directly. Maintain face-to-face contact whenever possible. Provide for the resident's privacy with a curtain, screen, or door. Adjust the bed to a safe level, usually waist high. Lock the bed wheels. Remember to ask the resident about his or her preferences during care and to promote the resident's rights and safety while giving care. Make sure to gather all of your needed supplies before beginning your procedure. Here's the equipment you'll need to perform this procedure: bath blanket, disposable bed protector, bath basin with warm water, soap, bath thermometer, 2 to 4 washcloths or disposable wipes, 2 towels, gloves, linen hamper or bag, trash container. For this procedure, we are using a training mannequin. You will place a bath blanket over the mannequin and fold back the top bedding before beginning. After filling the basin with warm water and testing it against your wrist or with the bath thermometer, have the resident check the water temperature to see if it is comfortable. Adjust if necessary. Put on clean gloves before washing the resident. Place a clean protective pad under the perineal area. During the procedure, remember to only expose the area necessary to clean the catheter. Avoid overexposing the resident. Wet a washcloth in the basin. Apply soap to the washcloth. Clean the area around the meatus. Use a clean area of the washcloth for each stroke. While holding the catheter near the meatus without tugging, clean at least 4 inches of the catheter nearest the meatus. Move in only one direction away from the meatus. Use a clean area of the cloth for each stroke. Dip a clean washcloth in the water. Rinse the area around the meatus.
So it's just one circle. You do like half
Use a clean area of the washcloth for each stroke.
Got stroke. Was.
While holding the catheter near the meatus without tugging, rinse at least 4 inches of the catheter nearest the meatus. Move in only one direction away from the meatus. Use a clean area of the cloth for each stroke. While holding the catheter near the meatus without tugging, dry at least 4 inches of the catheter nearest the meatus. Move in only one direction away from the meatus. Remove the bath blanket and cover the resident. Empty, rinse, and dry bath basin. Place basin in designated dirty supply area. Place soiled clothing and linens in the hamper or bag and avoid contact of your clothing with soiled linen. Remove and discard your gloves and wash your hands. Help the resident get dressed if needed. Then complete the rest of your ending steps. Return the bed to its lowest position and remove the privacy measure.
So call light, put the bed down to the lowest position, put the privacy privacy
Place
curtain
the
back.
call lights within the residence ring. For residents who have urinary catheters, daily care of the
This is
genital
the same
area
girl,
is
wasn't it? Someone? Yeah. There we go. This is what we're getting ready to do in person. This morning I had trouble with the video too, but it just took us a few seconds to get loaded for some reason. I thought it was our Wi-Fi at the time, but there we go.
Hello, Ms. Jones. My name is Patty. I'm your CNA today. How are you? Great.
Introduction,
I need to empty your urinary drainage bag. Is that okay?
explaining the procedure.
Okay, I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back.
Close the privacy curtain.
For this skill, I'll need a barrier, which I'll place on the floor under the drainage bag. I'm going to need a set of gloves. And I'm going to need a triangular graduate container. I want to inspect the catheter tubing to make sure that it's coiled on the bed and the patient isn't lying on it and it's not hanging. But also that it's not hanging near the floor where somebody might get their feet tangled up in it and trip or accidentally rip the catheter out. This catheter looks like it's in the appropriate position. We'll now remove the port from its protective sleeve on the bag. Sliding the valve to the side will
We have
open
the
it.
same exact one we're
We
gonna do.
can now position this open port over the graduated container and tilt the bag slightly to the side to allow the contents to drain into the graduated container. While doing so, we want to be careful not to allow that port to touch any other surface. Once the urine bag has been emptied, we'll slide the port back to the side to close it and very carefully insert it back into its protective sleeve. We want to make sure that the bag is hanging on a non-movable part of the bed and it's not touching the floor. We can now fold the chucks over the graduate container for safe and secure transport to the patient's bathroom. Once we're at the patient's bathroom, we're going to set the graduate container down on a barrier on a flat surface and position it so that we can read it. We need to be at eye level, and we're going to round to the nearest line, either up or down. You can see that the urine in this container is nearest to the mark of 425, so the amount that we will document is 425 milliliters, 4 cc's. Once we've measured it on a barrier, on a flat surface, at eye level, we can now empty the urinary graduate container. We'll throw the barrier away, open up the toilet, and we're going to dump the contents of the graduate container into the toilet. Now we're going to rinse the graduate container. We'll deposit the rinse water into the toilet as well. Now we can clean. After dumping the rinse water into the toilet, we'll set it down, use a paper towel to pick it up, paper towel to dry the outside, paper towel to dry the inside. We'll discard this and then wash for the drawer. We're going to place the graduate container in the bottom drawer and close the drawer with a paper towel. Okay, now I'll throw the paper towels away and remove my gloves. We'll throw those away as well. Thank you very much, Ms. Jones. Is there anything else I can get for you while I'm here? A magazine, perhaps? You have your call now. You can see that the urine in this container is nearest to the mark of 425, so the amount that we will document is 425 milliliters or cc's. Once we've measured it on a barrier, on a flat surface, at eye level, we can now empty the urinary graduate container. We'll throw the barrier away, open up the toilet, and we're going to dump the contents of the graduate container into the toilet. Now we're going to rinse the graduate container. We'll deposit the rinse water into the toilet as well. Now we can clean. After dumping the rinse water into the toilet, we'll set it down, use a paper towel to pick it up, paper towel to dry the outside, paper towel to dry the inside. We'll discard this, and then one for the door. We're going to place the graduate container in the bottom drawer and close the drawer with the paper towel. Okay, now I'll throw the paper towels away and remove my glove.
Yes.
Why are you dumping it in, like, the commode?
That's a good question. So the commode is mainly there because there's no other toilet in the room. So it's really there to mimic the real toilet.
Okay. Cause,
In our lab too, the day you take your test, you also have to use the bedside commode because we don't have a bathroom in there.
so we pour an extra cup of rinse water after we do that? Okay.
Yeah, so then you'll need to go over to the sink, get the rinse water, and then pour it in. Good question. So, you know, if it's easier if you have a toilet in the patient's room, right? Because you're not going to use that commode at all. Even if it's there, if you have a toilet in the patient's room, then you would simply pour the urine down the toilet. You don't have to flush it yet because then you need to do some rinse water real quick and pour the rinse water in the toilet, then
So-
flush.
Do you clean the cup after the rinse water before? I forget.
Really, the rinse water in theory and then dry out with paper towels after that is supposed to be the only thing that you do. So that is not used for anything but urine.
Okay.
Also, if the patient has their own bathroom, you might find this graduated cylinder in the bathroom near the toilet. Does that make sense? If they have a Foley in their room, then more than likely this measuring device is going to be kept in there since it's touched urine and so forth, even though there was a rinse done.
Okay.
Yeah, good question. All right, so I'm going to have you guys come up here in groups of 2. You're each going to have to do it, and then we will go to break and then come back for some more lecture. Okay, so this is a very short skill. I have some gloves up here. Colton and Jasmine, why don't you come on up? I'm going to pause the video.